Thank you, Dr. Che. My name is Wonjae from Seoul National Bundang Hospital. I'm an interventional cardiologist and also attending staff at International Healthcare Center. Would you show my slide? Okay, thank you. So I'm going to talking about our strategy and the processes of fighting with in-hospital transmission of COVID-19, and also I'll spend some time to introduce a community treatment center, which is unique in Korea. And if I have some time, I'd like to share some cases as well. So Seoul National University Bundang Hospital, we are a safe hospital designated by the government. In Korea, there is about 300 hospital which is designated safe hospital. What is safe hospital? These hospitals, patient respiratory symptoms are isolated from other patients during the entire care process, so from the visit to admission. So to do that, we have a summer facility instead. So this is our hospital structure. These are two main buildings. And we have something called COVID-19 clinic right outside of hospital for patient with respiratory symptoms. We do have a screening center right in front of our emergency department for patients with symptoms. And we have also something called high-level isolation units. I'm going to go into details of these facilities later. And this is flow chart for our triage. So every visitor we screen at the hospital entrance, and if they have some respiratory symptoms like cough or sore throat, or if they have fever above 37.5 Celsius, they're going to be sent either to COVID-19 clinic or triage ER according to their risk factors. If they don't have symptoms, they'll be able to see doctors in outpatient clinic. Also, all patients coming to our emergency department will be screened 24 hours. If they have risk factors, they're going to be sent to isolation area. If not, they're going to get their needed care. When they need admission, they're going to be sent to either of these three facilities, which is high-level isolation unit and the other isolation unit or preemptive isolation unit for their further care. So let's look at our lobby of main building. So this is the entrance, and right side of this entrance we have a desk for questionnaire before entrance. So all the visitors will fill out their forms here, and right after that they're going to get a temperature check, and they're going to submit this form to our staff right here. And our staff will evaluate, and they're going to issue either pass, or they're going to send this patient to COVID-19 clinic or ED triage according to their risk and symptoms. This is an example of a screening questionnaire currently used in our hospital. And whenever they're passed for this screening process, they're going to get this hospital entry pass so that they can get their treatment in a hospital, and this will be only valid for 1 day. Let's look at more detail of the screening process at COVID-19 clinic. So doctors will assess epidemiologic risk and symptoms here. If they're highly suspicious, they're going to order COVID-19 test right away. If they have a little suspicion, they're going to order chest x-ray, and if normal, they're going to issue confirmation for further medical care in our hospital. Of course, if doctors think that they're not suspected, they're going to be also able to get their care. What they can get here is that if they just need the repeated prescription, they can just also get the prescription here and go home as well. So when these visitors are tested for COVID-19, they're going to get their result by SMS if their result is negative. But if the result is positive, they're going to get a call from medical staff and get further instruction. This is the overview of our COVID-19 screen. So this is right outside of the hospital, and we have two clinics for which is equipped with negative pressure like here, and this is inside of the clinic. And also we have waiting area right here, also portable x-ray placed here to check the pneumonia. This is just for your reference, the simple flow diagram for our COVID-19 screening clinic. Next, this is our triage at the ED. So basically, we have three screening rooms just right outside of our emergency department like this. This is 24-hour screening center for high-risk patient. And if they're not suspected, they're going to go directly into our main ED. But if they have some suspicion, they're going to send right to the isolation area. And this is detailed picture of isolation right here. All the medical staff has to wear N95 respirator. And for patients with mild symptoms, they're going to put in area 1. But if they have high risk and some other symptoms, they're going to put isolation, the room, place it right here. And after the ER, if they need to be admitted, they'll be sent to either of these facilities. So the first is high-level isolation unit, which is equipped with negative pressure. We have 9 beds for this, and this is for confirmed case with severe symptoms. So this is actually national designate for emerging infection disease, such as MERS or Ebola. And this facility can provide ICU care, including ventilators and CRRT or even ECMO. We also have something called renovated isolation unit, which has 11 beds, and this is for moderate cases of confirmed COVID-19. We have something called preemptive isolation as well. This is actually originally 45 beds unit, but we made it down to 15 to 23 as needed. And this is for pneumonia of unknown cases or patient with high epidemiologic risk. So this is again the overview of our National Inpatient Isolation Unit, which is designated by government after the incidence of MERS. So as you can see here, this has a completely separated entrance from the main building's hospital right here. And in the usual time, this is used for suspicious patient for MERS or Ebola or even the other emerging infection disease. And for now, this is dedicated for COVID-19 severe cases. These are some of the pictures of our isolation unit. So we have CCTVs in all rooms so that they can be centrally monitored in the nursing station. And this is a picture of a negative pressure room. So you see the bed here and a ventilator, and there's ample space for CRRT or ECMO when they're necessary. And these are pictures of our PPE donning and doffing rooms. As the number of confirmed patients increases, we had to open another ward for isolation. So this word is actually was used for respiratory patient in the usual time. So we had 3 isolation rooms with negative pressure, but we added 8 more by using the negative pressure portable machine. So currently we have 11 more beds with the negative pressure capability. And the last is preemptive isolation ward. This is sort of unique. This has a 3 grade here. If patients have a very high epidemiological risk and symptoms, and they're going to put right here in rooms with negative pressure until the COVID-19 test results are reported. In this green area, which is grade B, this is preemptive isolation of 8 rooms for atypical pneumonia. And here, grade C is for patient with epidemiological risk, but who are asymptomatic, and they're admitted due to other reasons such as chest pain or abdominal pain and other disease. So they're going to be observed here until their COVID test came out. Still, there can be some missing points, so we have a final check-in process. So when patient admitted or when patient are to visit our outpatient clinic, nurses can access to DUR information, which is shared by our Korean CDC. So this is actual pop-up screen of the alert. It's saying the first one, this patient just visited the high-risk country outside Korea, and this one is saying, this patient has a close contact history of confirmed cases. So when there is a suspicion, we have to contact infection team, and they're going to do further management. Government temporarily granted these hospitals to do telemedicine because of COVID-19. So our hospital encouraged patients for selected cases who have had previous visit to SNUBH and are clinically stable and need prescription for the same clinical diagnosis, then we recommend the telemedicine. So what we do is that before 1 or 2 weeks before their clinic appointment, we advise to get their consultation through phone. And after they get a consultation with the doctor, we're going to send their prescription to their nearby pharmacy so that they can get their drugs easily without visiting our hospital. We are doing regular decontamination of our public spaces by our specialty companies. And I'd like to move on to some of the major rules that are done to our in-hospital staff. So the criteria are set based on Korean CDC criteria, and then this is all organized by Occupational Health Office of our hospital. So we do preemptive quarantine at home for following criteria. So symptomatic healthcare workers who has fever or cough or other respiratory symptoms, we recommend them for self-quarantine until the COVID-19 test is available. When they have high risk of epidemiologic risk factors, such as contact with confirmed cases, or they just have returned from high-risk area, such as Daegu, Gyeongbuk area, or if they just returned from countries with the community transmission, we also advise them to do self-quarantine for 14 days. Of course, people with contact with confirmed case, they have to get their testing or they're symptomatic. But in addition to that, if hospital staff are suspected contact with confirmed cases, we also recommend COVID-19 test, and then we quarantine until the test result is available. And then our health infection team also send out regular messages by a smartphone. For example, in the middle, every day we get our self-symptom checklist like this, and we have to fill this form until 10 a.m. And if not, we're going to be called by the team. And then if there is some new instruction coming out, it's going to constantly shared by the smartphone, and all the contact history will be also shared by smartphones. I think we can never be enough to emphasize the importance of mask and hand washing. So every staff in our hospital has to wear their mask all the time in our hospital. I'm not sure you can see it clearly, but we have this blocking panel in our actually in cafeteria. So to prevent the droplet during having the lunch. And I think it was at the end of March, we converted all the conferences and meetings to teleconferencing to prevent the spread of the disease, and we are imposing stricter social distancing for our staffs. US CDC just updated the guideline last week, so I'm sharing this slide for reference. So I think this is really good for guideline for exposure risk of healthcare workers, patient, and monitoring and work restriction. Since there's more and more patients with the COVID-19, so it's not enough to tackle all these patients with infectious prevention only. So now we are training other healthcare workers for the PPE. And for special situation like CPR, we're doing training for simulation as well. So here, this is a picture for the training process for CPR. And also, this is a picture of a negative pressure cart, which is used to transfer patient. I'd like to move on to Community Treatment Center. So this is basically non-medical facility repurposed for the treatment of mild COVID-19 patients. So this is a cooperation between a private corporate who provided the facility and also support the government and the hospitals for the medical staff. So basically this is for management and treatment of mild COVID-19 cases. So for example, patient who can discharge from the hospital but still with the RT-PCR positive, they're going to send to this facility. Or patient confirmed with the COVID-19, and if they're old and they have multiple comorbidities, they'll be sent here for safe return to daily life. So basically, we have a control center in our hospital, SNUBH, and we have a operation center at the site. And we do telecommunication for patient care. And actually, in this area, one doctor and several nurses are here 24 hours to tackle the urgent cases when needed. And this is an actual picture of a doctor consulting with a patient in the facility. We have placed specimen collection booth outside of the building to minimize the contamination of the building. We also have this X-ray machines there as well. And this is a picture of the isolation beds in the facility. So basically, if patients are well and well treated, they're going to step down to this non-medical facility, or some hospitals have severe symptoms that they're going to be sent to tertiary hospital in our area. I'd like to touch a little bit of drive-through. I think this is so popular already around the globe. So basically, this is a very simple and faster and safe way to test COVID-19. So as you can see here, it's just basically you just drive through and visit registration and the consultation and payment if necessary, and specimen collection like this. So actually, this is helpful both for patient and also for a healthcare professional as well, because all the visitors will just stay in their car to minimize contact with the healthcare professional. But at the same time, healthcare professional only need to get down the window and just swab, so they can really minimize contact with the potentially infected patient as well. So this is the picture of a KCDC. You can always search nearby facilities, and right now in Korea, I think there's about 70 spots available for this drive-through screening process. Okay, so I have sometimes I'm glad to share some of our cases, actual cases in our hospital. So luckily, we did not have a confirmed patient case so far. So I'm gonna just talking about some patient with epidemiologic risk of COVID-19. So what happened? 80-year-old lady, she presented with chest pain and dyspnea at our ED. And then she was recently admitted, we figured out that she was recently admitted to hospital, which is locked down now due to in-hospital outbreak. So what we did, at the emergency department triage, we figured out that she had a recent history of high epidemiologic risk. So we sent her right away to this isolation area and isolation room here. So we started initial management and COVID-19 testing. And since this patient needed special care of cardiologist, we transferred the patient to preemptive isolation ward. So after having our COVID-19 test negative, we could transfer the patient to cardiology ward and do the treatment accordingly. Next case is in-hospital split confirmed COVID-19. This is actually the headline of a newspaper. Actually, it was all over the country during that time. So it's here saying Seoul National University Bundang Hospital Pain Clinic, one of in-house staff confirmed, and she was a member of a SNUBH church. So what happened? She was 35-year-old female. She was asymptomatic, and she was working at information desk at the pain clinic on ground floor level 2. And she was actually later found to be a member of SNUBH church. So she got testing at the one of screening center on Sunday afternoon. And since she was working for hospital, the healthcare workers there advised her to do self-quarantine. However, she came to work the next day in the morning, and she contacts several of our staff. But at 9 a.m., she got the result from the screening center, and then she reported her result right away to the hospital. Luckily, she was wearing mask all the time, in and out, in the hospital or when she commute. So what we did, we transferred the patient to the isolation ward right away, and then we locked down the pain clinic. We quarantined all staff of the pain clinic until test results was available. And we started testing with these people right away. At the same time, we start tracing and ordered further testing of healthcare workers who are suspected to be contacted, such as people working in the same floor or people using a shuttle bus at the same time of the patient, and also some patient suspicious secondary contact. For those who have tested negative, but still we quarantine them for 14 days if they had a very close contact with the healthcare worker. So this is another headline which was on the newspapers. Thanks to mask, the confirmed case, Bundang's Seoul National University Hospital did not have further spread, and all the tests was negative for all the contacts. This is the last case. So we actually had some call from international patient who has high risk pregnancy. So she actually flew from the United States to seek safer care environment since there was huge outbreak in the US. And then she actually had a previous history of miscarriage and premature birth, and she needed urgent checkup. So she contacted our international healthcare center. And then we confirmed that she had a negative confirmed result from at airport screening center, but still to government rule, she had to be quarantined for 14 days. But since she needed urgent care, our staff consulted with local public healthcare center and also our infection team in our hospital. And then we had to answer that exception is granted for urgent care. So then we coordinated with specialists and nursing staffs of OBGY, and specialists also confirmed that she should get the checkup. So she visited our hospital and visited our ED triage, and safely she got consultation and sonogram by specialist at the end of the clinic hour to manage by exposure. So this is what I prepared for today. It was really honored to speak in front of you all, and I hope this was a meaningful time for you. The picture shown right here is the pictures of our healthcare workers fighting corona in Korea. And whenever I see these pictures, these are really overwhelming. Right here, these are fighters who are working in Daegu where there's a huge outbreak. And these are people from all over the country to support people and to support and volunteer in the Daegu area. And you see this is food truck. A lot of private companies supported a lot of healthcare staff who are fighting COVID-19 virus. So I'd like to use this opportunity to thank all of the healthcare workers in Korea, not only in Korea, but around the globe who are dedicated themselves to fight this disease. Thank you.